I currently occupy the role of Head of Equity and Racial Justice. I think it's important for communities to have a voice in their care, in how they access it, in the treatment and in also the outcomes, because as the people who are going through that journey, they know what's best. There are different belief systems, different value systems that different cultures have. And there's something about knowing these and then responding in a way that's really appropriate to the person who's in front of you. In order to do that, you need to be trained in a way that is culturally competent. So you have a wider understanding of the different cultures that exist. We know that people experience excessive use of force. There are higher detention rates for Black people in particular. So that's one thing that really needs to change, is the reform to the Mental Health Act itself. The way psychotherapy is at the moment is quite colonial. The approach is colonial, so the teaching around it is as well, and it's not always appropriate to communities of colour, because there are people who are Black that go to therapy in its traditional form, and it really works for them. But for those people who perhaps it doesn't work for, I just wanted to be able to provide a service that's an alternative and has a wider remit. So what we know previously is that it's been done a little bit ad hoc in terms of co-production, but what the PCREF, or the Patient and Carer Race Equality Framework, has done is created a framework that holds people to account. So that includes NHS trusts and also all mental health service providers. The PCREF itself comes under 3 parts, and one of those parts is around patient and carer feedback. So it makes that co-production element a core part of meeting the requirements of that framework.